So what cognitive and behavioral therapy does is that we have a particular kind of behavior that needs to be modified. There we have this faulty thinking, which is cognition, and we have to modify that. What's up, you guys? Aditi. Welcome back to our channel. We have already spoken about two types of therapies. First is psychotherapy, and the second one is insight therapy. You can check that video here. Today we'll talk about two other kinds of therapies, which is cognitive and behavioral. So we have already heard of CBT, which is cognitive and behavioral therapies, but there are just only behavioral therapies as well. So I guess we'll first start with that. So what cognitive and behavioral therapy does is that we have a particular kind of behavior that needs to be modified. There we have this faulty thinking, which is cognition, and we have to modify that. So if we change our thinking, our behavior will also change, which is CBT. So that is the main purpose of cognitive therapies, behavioral therapies, or cognitive behavioral therapy. Behavioral therapies focus directly on the problematic behaviors that are involved, and not on the underlying causes like in insight therapies. In insight therapies like psychodynamic therapy or psychoanalytic analytical therapy, or in psychotherapy, they do talk about childhood issues, they focus on childhood issues. But in behavioral therapies, they do not do that. They are not trying to find the underlying cause behind the faulty or the problematic behavior. So basically, it will focus on things like somebody who is drinking too much, or maybe being unemployed. So they cannot hold a job for a longer time, and they are being unemployed. Things like that. So any kind of maladaptive behavior, that is the focus, that's the aim. And actually, as on the aim, you find out what the problematic or the maladaptive behavior is, and the aim is to change those behaviors. So behavioral therapy involves discovering factors that trigger and reinforce problem behavior, specifying a target behavior to replace it, and then manipulating these factors to bring out the desired behavior. So what behavioral therapies do is that it helps clients develop these skills or behaviors that will help them cope with different life situations, which is causing them to behave a certain way. So there are different kinds of behavioral therapies. Like, we are going to talk about, I think, two of them today. So first is token money, token economy. So token economy is where to inculcate good behaviors in people, they are given small tokens which can be later exchanged for bigger rewards. So like, let's say this is actually used by Starbucks and stuff. This is like one of the operant conditioning, where you buy n number of drinks from Starbucks, and you keep getting points which you keep on collecting. And then once you have n number of points, like let's say after you have 500 points, you will get one drink free, or you will get it for half a drink, something like that. This is exactly what token economy is. So token economy can be used by parents or teachers to inculcate good habits in children, like in school or at house. So if it's done at house, then they should have this chart which is visible for the child, but in school one shouldn't do that. So what is done is that every time the child does something good, like maybe folded their laundry, or maybe made their bed, or did their homework, helped around the house, or something like some kind of good behavior they're trying to inculcate, they will get those many amount of stickers on the chart. And you're going to decide, it's going to be predetermined rather, that okay, once you have these, like once you have 20 stickers, that's when you can get maybe a toy or anything that the child actually really wants. But this can be done for inculcating good habits. If you want them to refrain, or you don't want them to do particular habits, like maybe they throw tantrums, or maybe they hit other children or their siblings or something, some kind of bad habits, then you cannot prolong the time when you give them a bigger reward. Maybe you have to start giving them the bigger rewards first, like kind of like immediate instant gratification. So it's really important, like if you're doing it with children, it's really important to know that when you need to reduce, like maybe you can increase the number of stickers they need to collect before they get the bigger reward, or like how to transition and maybe stop doing this sticker chart thing, because you can't keep doing this forever and ever. So this is very important to know the timing of it, because if it's done too early, then the habit isn't inculcated, and if it is done too late, then the the purpose is lost. So it's really important to know timing. So I just give an example of the Starbucks and how it can be used with children, but this can be done with anybody, because Starbucks thing works for adults, doesn't it? You can also do it with adolescents as well, teenagers, but you need to find maybe not stickers. You have to use something else that could work with them. They may be like a little hesitant in the beginning and even a little resistant, but if you use the right tools, they'll do wonders. Second behavioral therapy is desensitization or exposure based therapy. So, desensitization is a method of controlling anxiety by learning to associate an incompatible response like relaxation with a fear provoking stimulus. So, basically, what exposure based therapy is, that let's say you are afraid of a dog. So, your therapist is going to expose you to dogs, but not like directly, like little by little. Maybe you will start with just seeing dogs pictures, then maybe you will start maybe seeing puppies because they are a little less threatening and also really really cute. And ऐसे करते 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 the final stage would be actually encountering with a dog. So every time you are exposed to any dog like stuff like pictures and then puppies or whatever, you're also going to be taught to relax your body and your mind. So this is really a really good technique for people who have anxiety and phobic disorders. Another type which is used with PTSD, people who have PTSD, is similar to exposure based therapy or desensitization, is virtual reality therapy. So basically it's the same concept but with VR technology, where let's say somebody like a war veteran, he would wear the VR thingy and he would go back into the war zone, and then he'll be taught to or will be taught to do the relaxation techniques. So it's the same thing but with virtual reality technology. So the same thing can be used with people who have phobic disorders as well, or somebody who has phobia. So let's somebody has acrophobia, so fear of spiders. So maybe it is difficult to actually find a spider for them to interact with. So maybe they could just see a spider, small, big, larger. Ron Weasley could actually learn so much from this. So we have already seen behavioral therapies. Let's go to cognitive therapy. So cognitive therapies is about, you have these faulty thinking, you have a way of thinking about things, like maybe you have a negative self-talk, or maybe you have this hostile cognitive mindset where when somebody has behaved in a very neutral way, but you still consider it as aggression and you're ready to fight. So we have faulty way of thinking, and what cognitive therapy does is kind of rewire our brain and change the way we actually think. What cognitive therapy claims is that people's actions are shaped more by their own interpretation and reactions to external events than by the events themselves. And like I said, for behavioral therapies, even cognitive therapies, they're not deep rooted like insight therapies. They just work on the cognition, and that's it. The goal of cognitive therapy is to help people change the way they think, replace the maladaptive thoughts with the ones that promote growth. So like I said, somebody may have a way of thinking negatively about them. Like for example, I got a very low grade, and I will start thinking how stupid I am, I'm so dumb, I can never do this, I don't have it in me, I'm extremely lazy, I'm a dumbo, I'm not worthy of it. So what a cognitive therapist would do is that maybe they will ask me to like realistically evaluate the situation, maybe ask me to look at the situation differently, change my perspective, maybe asking me like, did you study for it? I like, yes, I did study, I used to study till late night, I have solved thousands of sums, so that shows that I did work hard, and that shows because I'm not that dumb. Maybe the paper was really difficult. The therapist may ask me about, okay, did anybody else score, was the highest that somebody has scored, was the lowest they have scored? So maybe that can give me an insight on like, oh no, like nobody has scored very like really high, maybe everybody's got an average score, and so is my score, like quite average. So by helping me see the situation differently, changing my perspective, my negative self-talk will be reduced, and I will see the situation for the way it is. And the last is combining both cognitive therapy and behavioral therapy. So cognitive behavioral therapy, which is CBT, where the aim is to replace maladaptive behavior and maladaptive thoughts by good ones, nice ones that will promote growth and happiness. Happiness? There are multiple, like very different kinds of CBT. There's REBT as well. So I don't want to get too much into it. Maybe I'll make a separate video on that. So yeah, that's it. I guess this video is going to be really short, but it fits. So yeah, that's it. Like, share, subscribe, and I'll see you next Friday with another psychology video.